In this video, you're going to hear from physical therapy, anesthesia, Dr. Perona's physician's assistant, and patient and family services. My name is Bridget. I'm the total joint coordinator, and I'll be your contact prior to surgery and the first few weeks after surgery. First, for preparing for total joint replacement surgery begins weeks prior to the actual surgery. So the appointments that you're going to need prior to the surgery include preoperative testing, which is a chest x-ray, an EKG, and fasting blood work. You'll need medical clearance from your primary care provider. That's usually done within 30 days of surgery. You'll need dental clearance, which is good for 6 months, and then any specialist that you see if necessary. You'll also come in for a history and physical, which is done in Dr. Perona's office with his physician's assistant. You'll have a pre-anesthesia screening phone call. They review your medications with you. You'll do prehab appointment, which is physical therapy, goes over physical or exercises with you prior to surgery. You'll also have a COVID screen prior to surgery, which you'll have to quarantine from your COVID screen on until the end of your surgery, or until the day of your surgery. Other things to consider, quit smoking, preparing your meals, and having footwear available to walk in after surgery. What to bring the morning of surgery? You can wear in your own mask. They will hand you your own mask at the door. Once they take your temperature, they will require you to change that mask out up in same-day surgery. But for now, on your way in, you can wear your own mask if you're comfortable. You can bring in loose pajamas, shorts, pants, anything that's loose and will not rub against the incision site. Footwear, slippers, shoes that are sturdy with a non-slip rubber sole. Any corrective shoes, if you wear those, we want you to bring those in with you the morning of surgery. Dental, deodorant, hair care, anything like that. And your personal items like glasses, hearing aids, the batteries, and dentures. Bring in your CPAP machine, a cell phone charger, and if you have your own walker, we want you to bring that in with you the morning of surgery as well. Home pillow if you want. Leave any other valuables at home. We do want you to have your inhalers here, any lotions, creams that you use, eye drops, and nasal sprays you can bring in with you the morning of surgery. So the day before surgery, you'll receive a phone call from me to confirm your procedure. The time you need to arrive at the hospital will go over your surgical instructions and your arrival time. So for Monday surgeries, you'll be getting a phone call on Friday afternoon, and then Wednesday surgeries, you'll get a phone call on Tuesday afternoon. You'll want to remove any nail polish on that operative side. So if you're having a right hip done, you want your right toenails, nail polish removed. You'll shower, use the antibacterial soap that's provided, and then sleep in clean pajamas and laundered linens. You don't want to eat or drink anything after midnight, so no gum, hard candy, no smoking, chewing tobacco, anything like that after midnight. Don't use any lotions or powders before coming into surgery. The day of surgery, you're only going to take the medications that you've been instructed to take. You'll take it with a small sip of water. You'll not drink anything the morning of, and then don't wear makeup or jewelry into your surgical procedure. When you arrive, they will get your temperature, hand you a mask, and you'll go straight up to the 4th floor for same-day surgery. They'll register you upstairs. Once you get upstairs, they'll get you into a gown and they'll begin to prep your operative side. You'll be taken to a room to be clip prepped. Then they'll use antibacterial wipes on your leg. They'll begin an IV, vital signs will be taken, and this is when anesthesia will come in and meet with you, and you'll sign your anesthesia consents. Dr. Perona's physician's assistant will be up to meet with you as well. She'll mark the operative side. And then this is the time that you can ask any last minute questions that you may have for anesthesia or Dr. Perona.
Hi, my name is Carrie Lopez, and I'm one of the physician assistants that works with Dr. Perona. I'm going to continue our talk on joint replacements, starting with the surgical timeline. As Bridget said, you're going to arrive to the hospital approximately 1 to 2 hours prior to your surgery. Once you arrive, you're going to meet with anesthesia and someone from Dr. Perona's office. After that, you will be transferred to the OR. At that time, we're going to start preparing you for surgery. We're going to place a Foley catheter in, and for those of you having a total hip or a total knee replacement, we are going to be giving you a spinal anesthetic. Then, while you're in the OR, we will position you on the operating room table. To position you, we do have to use Velcro straps, and you may notice some bruising come on days after your surgery. It is not uncommon for patients that have a total shoulder replacement to have bruising in the upper chest and breast area and down the arm. Patients who are having a total knee replacement may notice bruising around their thigh because we use a tourniquet in that area. They may also have bruising extending down their legs. Patients who are having a total hip replacement, most of the time just notice bruising around their buttock area where the incision is, but you might notice bruising in other areas from straps as well. This bruising will heal just like other normal bruises. After we position you, we have to sterilize the skin. We use a medication called chlorhexidine, which has a bluish-greenish coloring to it. Therefore, your entire limb will be blue for several days until it washes off. For the total shoulder replacements, your entire arm will be blue, including your fingernails. A lot of times patients get disturbed by this because they feel that there's a circulatory issue when really it's just leftover antiseptic. For the leg, the entire leg will be colored blue with the sterilization. After we sterilize you, we use sterile drapes and then we call for doctor. The time it takes to prepare you for surgery before doctor enters the OR room is approximately 1 hour. Doctor then will come in and perform the procedure. The procedure takes approximately 1 to 1.5 hours. After that, doctor will leave, and the physician assistant that is assisting Dr. Perona will need to close the skin and place a bandage. We do 3 layers of closing of the skin. They will not be visible to you as the stitches will dissolve under the skin. For the total shoulder replacement, your incision will be here in the front, and it'll be secured the final layer of skin with steri-strips that will be removed 1 to 2 weeks after surgery. For the total knee replacement, your incision will be in the front leg, right in the front of the knee. That incision will be secured finally with staples that are approximately 1 inch apart. These staples will be removed approximately 1 week after surgery. For the total hip replacement, your incision will be in the buttock area, and that incision will also be secured with staples. Now we use different kind of bandages depending on the quality of your skin and where your surgery was. For the shoulder and the hip, a lot of times we will put a bandage on that will stay for 7 days total. This is what the bandage could look like. This bandage would be placed on the incision in the OR and remain on for 7 days. Certainly, if this bandage becomes soiled or if it starts to bleed through, we would have to remove it. Other surgeries, like the knee replacement, we would use a bandage that would be changed daily. Most of the time, our knee replacements bleed a little bit more than the shoulder and the hips. Those bandages would include something like an ABD that would just kind of collect all of the blood or drainage from the incision, and then it would be secured with acrylic wrap. We need to make sure that you understand that if there is any bleeding or draining from any of your incisions, that is a potential site for bacteria to get in and cause an infection. So a good rule of thumb is if something is coming out of the incision, it's very important for you to make sure that bacteria doesn't go into the incision. And we need to keep that covered with a dry, sterile bandage. We will definitely go over the bandages and the instructions with you while you're in the hospital. Also, one thing to remember is if you're having the Mako Assist surgery, you will have additional incisions. The Mako Assist surgery is only available for the hip and knee replacements. For the hip, that incision would be a little bit higher on the bone in this area, and it would be approximately 1 to 2 inches, secured with steri strips that would be removed in 1 to 2 weeks. If you're having the Mako Assist total knee replacement, that incision would be lower on the shin than the original incision, and that incision would be approximately 1 to 2 inches, and that would be secured by steri strips as well. Again, we will go over all the incisions and bandages with you before you leave the hospital. Another thing that may happen with a total joint replacement, particularly with the hips or the knees, is we may choose to use a wound vac. A wound vac could be decided to be placed when you come in for your history and physical, or we could decide to place it on you in the operating room. It really just depends on your body habitus and the quality of skin if we use a wound vac. Vac can be remembered by vacuum. Basically, what a wound vac does is it sucks out any moisture, bleeding, or drainage that would be coming out of the incision. It's placed on in the operating room, and therefore it's completely sterile, and your risk of infection is then very low. The wound vac would stay on for a week, therefore you would go home with the wound vac, and instructions would be given to you. All of the fluid that is sucked out of the incision is then transferred to a little canister that you would be able to take home with you, and would be then removed when you come into the office at your 1 week follow-up. Not everybody gets a wound vac, but if you do get a wound vac, it will be discussed with you at length, and you can always call us day or night to answer any questions about the vac. It would take approximately a half an hour for the physician assistant to stitch you up and then bandage your knee, hip, or shoulder. After that, you would be transferred to the recovery room. In the recovery room, they will continue to monitor you until you are safe to either go home or be transferred to second floor or the ICU. Most of our patients are able to either go home safely or they go to second floor for a one-night overnight stay. After you leave the recovery, if you go home, all your orders will be given to you at length, and they will be written out for you. And of course, you can call us at any time. If you're going to second floor, you will be assisted by a team of professionals that will help you transition through this stage. That night, physical therapy will get you up, as it's important to continue to work towards ambulation and strengthening soon after the joint replacement. Okay, now we're going to talk about some of the equipment that you would see after the total joint replacement. The first thing we're going to talk about is the walker. And this definitely refers only to the total hip and knee replacement patients. A walker is needed after surgery to make sure that you can safely ambulate. Our physical therapy department is going to go over the walker with you and make sure that you safely know how to use it. You will be sent home with a walker. One will be provided for you if you don't have one, and the walker will be eventually transitioned from the walker to a cane and then ultimately without any assisted device. Please do not get up by yourself while you're in the hospital. Anytime you need to get up to go to the bathroom or for any other reason, please put your call light on. This is for safety reasons. We want to make sure that we keep you as safe as possible. Another piece of equipment that we will use is a catheter. You'll have a Foley catheter in that will be inserted in the OR, and this will be removed 23 hours after your first antibiotic dose. We do give you 3 doses of IV antibiotics to prevent you from getting infection, and the catheter must be removed prior to that last dose, as Foley catheters are potential sites of infection. So your catheter is planned on being removed and it is scheduled. The nursing staff can tell you what time it is scheduled to be removed. We also will have 2 IVs. We need intravenous access in case we need to give you medications for nausea, pain, or any other medical conditions. The IVs will be usually in your hands, but they could be in your arms depending on what veins work best for you. The IV access will continue throughout your stay in the hospital. Most patients leave the operating room with oxygen on. We will continue to check your oxygen level and determine when you're able to go off of the nasal cannula. We will possibly also give you a CO2 monitor. It's a little device that would go on your chest, and we would monitor your carbon dioxide, and that would tell us if we're giving you too much pain medication. Some patients need this device on, others do not. But if you notice a little circular orange device on your chest, it's just to keep you safe and make sure we don't give you too much pain medication. We're going to go over the Polar Care unit next. And this is basically an ice machine that we use for both the total shoulders and the total knees. This will be sent home with you, and we will go over it several times while you're in the hospital so you understand how to take care of this. The most important thing to remember about this ice machine is that the pad gets very cold. We put ice in here and water, and all that ice water moves through this tube onto this pad and circulates ice cold water that, if left on your skin, could give you an ice burn. I have seen patients receive ice burns from this device that actually required transfer to a wound care center. So it's very important that you protect your skin. This is a very safe unit if used properly. For the knees, a lot of our patients will have a bandage on, and then this pad would go on top of the bandage, secured by an ACE bandage that just Velcros it in place. For the shoulders, the pad looks more like a butterfly, and the pad would go on and around your arm. It's very important that you wear a long sleeve shirt so that you do not get an ice burn on the upper arm. It's important to remember that the Polar Care machine works on electricity. This will be plugged into your machine in order to get it to work, but it must be plugged into the wall. Please remember not to forget this when you leave the hospital. Every once in a while we'll have a patient who forgets this, and then they're not able to get their Polar Care to work. Now, some patients like to put frozen water bottles in their Polar Care. Not only could that damage the machine, but it doesn't get it as cold. The machine tells you exactly what to do. Inside, it tells you to fill water up about 1/4 of the way, and then the rest with ice. We do recommend that you plan ahead of time and get ice bags available or make ice so that you don't have to run to the grocery store to get ice when you really need it. Again, I cannot reiterate enough, the most important thing is to make sure that this Polar Care does not go onto the skin directly, as it could cause an ice burn. But if used properly, this is a very effective way to help with swelling and pain. The next thing we need to talk about is anesthesia and and pain medicine. What anesthesia and pain medicine can do to patients is it can slow down multiple systems. It slows down your breathing, it slows down your circulation, and it slows down your bowels. The next equipment we're going to talk about is to kind of help speed that up to prevent complications. One of the things that we use to prevent pneumonia is called an incentive spirometer. And this will be instructed by the cardiopulmonary department at the hospital, who will visit you, give you an incentive spirometer, and show you how to use it. Dr. Perona recommends that you use this every hour while you're awake. And you can do that every hour on the hour or every half hour. Try to remember not to forget. This will help prevent pneumonia. Another thing that we do to kind of help speed up your metabolism is to help protect against blood clots by speeding up your circulation, okay? We use this thing called an SCD. It's basically based on air pressure that is pumped in and it squeezes on your calf. So if this was my foot and this is my calf, air is pumped into this device. It gets very big, squeezes my calf and releases. And that mimics walking and it mimics circulation and it helps get the blood flowing. If your blood pools in your lower legs, you're at risk for blood clots, as well as swelling can be very painful. Another thing we use to help with swelling of the lower legs are these compression hose. And you'll hear them called TED hose. That is the brand that we use. But basically what they do is they squeeze up excess fluid from the foot, ankle, and calf so that your heart can pump it back into normal circulation. After a total joint replacement, patients just aren't that mobile, and it tends that they can swell in their lower legs. This is put on both legs after surgery, and when you go home, you will put these on first thing in the morning because that's when your swelling is the lowest, and then you can take them off at bedtime, rinse them out, and hang them to dry, and then put them back on the next morning. Another thing we talked about is slowing down the bowels. While you're in the hospital, we're going to be giving you a stool softener. And when you go home, we're going to recommend that you use a stool softener as well. But the most important thing that you can do to help get your bowels back to normal is to be active. Getting up with physical therapy, walking, being active is really going to help all of your systems get back to normal as soon as possible. Another thing we need to talk about is a nasal sanitizer called Nosen. Nosen will be given to you while you're in the hospital. It's basically just a little orange scented swab that you will break and use in the nose twice a day to help prevent infection while you're in the hospital. The nurses will go over this with you and make sure that you're using it properly. The next thing we need to talk about is who's going to come visit you in the hospital. You're going to see a lot of different faces, and now because of COVID, we're wearing masks all the time, so it might be hard to keep us all in track. But you will be seen by multiple different people, including a hospitalist. The hospitalist is the medical doctor that will come take care of you while you're in the hospital. Dr. Perona and his staff will be taking care of your shoulder, hip, or knee, but all of your medical issues will be managed by the medical team here at St. Margaret's. They will come and see you at least once a day, and they will take care of anything that comes up that requires a medical doctor. You will also be seen by social services. They are the department that is going to transition you from home from the hospital to home. You will either have the option of going home with home health services or home with outpatient services. What that means is you could go home and home health agency would come in and perform physical therapy 3 times a week. The nursing staff would also come in and assess you. Or you could go home and a family member could take you to the outpatient physical therapy center. We are St. Margaret's employees, and we love our St. Margaret's physical therapy department. They do a fantastic job, and we would encourage you to go to our department. However, we understand that some people live far away. We have patients come from all over the state to have Dr. Perona perform his surgery. So if you would like to do your physical therapy at another center, that's completely fine. Just let us know and our social service department will make a referral and you can do your therapy at that department as well. Of course, you'll be visited every day by the nurses and the aides who will be taking care of you. They are very, very helpful and know a lot of the answers you may have. If, however, they do not know some of the answers to your questions, they will contact our staff. Anesthesia will do a follow-up appointment with you as well. They will come in and talk with you about your anesthesia and how you're doing. Certainly, if you have any questions at that time, please discuss with them about any anesthesia questions. You will be seen by physical therapy. There are actually two departments in the rehabilitation center. There's physical therapy and occupational therapy. Physical therapy is the department that's going to come in and walk you and exercise you. Occupational therapy is the department that's going to work with you more on functioning. They're going to actually show you how to get in and out of a bed, how to get dressed, how to put your socks on. You will be visited by physical therapy twice a day and occupational therapy once a day. Prior to leaving the hospital, physical therapy needs to state that you are safe to go home. If you are not deemed safe to go home by physical therapy, we will continue to keep you in the hospital or look at other options such as nursing home placement. Of course, someone from Dr. Perona's staff will see you every day as well. We typically start making rounds around 8 to 8:30 in the morning, and depending on how many patients we have on the floor, we will be in your room between 8 and 10 a.m. Please, if you have any questions, write them down. We'd be happy to answer them. We will evaluate you in the morning, and we will come back later that day if needed. We definitely report back to Dr. Perona immediately if there's any concerns. Prior to your discharge, you will be visited by our pharmacist. They will go over all of the medications that you will be sent home with. We will send all your prescriptions to your pharmacy, and our pharmacist will go over everything with you prior to discharge. Your discharge instructions will also be typed out for you, and our nursing staff will go over with you them as well. I'd like to talk about pain. When you have a total joint replacement, this is typically not a pain-free procedure. Some patients go through this procedure with nothing more than a Tylenol. Other patients require 3 or 4 different kinds of pain medication. It really just depends on the way your body metabolizes and handles pain. Some of the things that we can do to help with pain is repositioning. Sometimes just rolling over or changing our positions, getting up and walking helps. The polar care that we talked about earlier, or just regular ice packs, a lot of times help with pain. We have an anesthesia department that is going to talk with you about getting a block while you're in the operating room. They will go over the blocks with you, but what the blocks do is help minimize your pain for the first 1 to 3 days. And patients really do like the blocks because it helps them have a very easy transition from the OR to the first 3 days of surgery. Some of the medications that we use for pain are anti-inflammatories. Now, anti-inflammatories can only be given if you are non-allergic and if you are not taking a blood thinner. Other medications we use are Tylenol and narcotics. Narcotics and Tylenol are straight pain medications. We will develop a pain plan for you when you come in for your history and physical. Basically, we try to get everybody to have multiple options, and if something has worked for you in the past, please let us know. Sometimes patients will say, Norco is something that I've had for other surgeries and it's worked well. Other patients have never been on a pain medication and they're willing to try anything. We will try to do what we can to minimize your pain, but there's no guarantee this will be a pain-free procedure. Our goal is to make your pain tolerable and to make you able to participate in physical therapy and to have a good night's sleep. Another pain medication that we use is called Gabapentin. Gabapentin is a neurologic pain medication that can be used to help as those nerves regenerate. It helps minimize the pain. A lot of times patients will be on gabapentin and an anti-inflammatory for the first 1 to 2 weeks after surgery. Most of our patients are off of all pain medication at 3 to 4 weeks. Of course, while you're in the hospital, if you require something stronger, we always have the option of doing IV pain medication. Having a total joint replacement is considered an elective procedure. It is not an emergency. Therefore, patients are able to get screened prior to their surgery by having their medical and dental clearances. But even by having a medical clearance, sometimes medical things do come up after surgery, which is why we have the hospitalists monitoring you. But the next section we need to talk about are potential complications. Things that could happen, things that we try to prevent, and medical complications are one of them. A lot of times patients will notice that if they have high blood pressure and they take a blood pressure medication every day, after surgery they're not given their blood pressure medication. This causes a lot of distress because they're used to taking their blood pressure medication every morning. One of the complications after an elective joint replacement is patients will have low blood pressure. Their blood pressure goes low and we therefore have to hold their medication. The hospitalists will manage this. Any medical complication that you have could be a result of some underlying medical condition. For example, if someone has asthma, they might undergo a joint replacement and then after the joint replacement have an asthma attack. If someone has migraine headaches, they may undergo a joint replacement and have a migraine headache. The stress of this procedure can cause any of your prior medical issues to come back, and that is something that our hospitalists will be able to manage for you. But it is something that you should be aware of. Another thing that can happen after a total joint replacement is confusion and sedation. Being under all the anesthesia medications as well as taking the pain medications, that can cause you to be a little bit sleepy. One thing that it's very important that you let us know prior to your surgery is your alcohol intake. We do not judge patients. However, if you are a daily drinker and you drink a lot of alcohol, we need to know that ahead of time so we can prevent complications. Sometimes we'll have patients come in that have had a total joint replacement and they're having a hard time after surgery because they're confused. And we go on to realize it's because we did not realize they had an alcohol issue. There are medications we can do to prevent problems for these patients. So please be truthful with us and let us know your alcohol intake. Alcohol aside, some patients still get confused or sedated after surgery. This is something that is transient. It usually passes within a day or two. Anemia is something that can happen as well. We do a blood count every day to check and make sure that your blood count doesn't dip so low that you need a blood transfusion. Most of the time our patients just need an iron supplement for a period of time, but again, this is something that we monitor regularly. When you go home, if you notice that you're very tired or fatigued, it could be your blood count is continuing to drop and you should follow up with your medical doctor. Nausea and vomiting is a common complication with any surgery. Please remember that we always have nausea medication ordered for you. If you feel even the slightest bit nauseated, let your nursing staff know, and there is something that can be given to help alleviate that symptom. With your bowels going a little bit slower after the anesthesia, we always have a stool softener ordered for you. If you feel you need something stronger, if you're having any abdominal pain or bloating, you need to let us know. Sometimes patients will develop a complication called a bowel obstruction, and that's when the bowels completely stop. This is a medical emergency. A lot of times patients feel nauseated, they vomit, their abdomen is very hard and distended. Any symptoms like that arise, you need to contact your nurse immediately, or if you're home, go to the emergency room. This is something that is very easily treated if caught early. Again, you want to monitor your bowels and make sure that you're having regular bowel movements. And we encourage patients to call their medical doctor if things aren't going as they normally would. A spinal headache is not something that happens often, but it's a complication we should talk about. Spinal headaches occur for the total hip or knee patients who have received a spinal anesthetic. They usually occur in younger women, and it's a positional headache. Patients state they feel fine when they're laying flat, but when they sit up or stand up, they have a headache. This is something that we need to know about, and if it occurs, please let the nursing staff know, and they will let anesthesia know to come in and evaluate you. Pneumonia is another side effect that can happen from slowing down your metabolism. Pneumonia is usually a complication that causes you to feel fatigued, like you have the flu, or you could start coughing. Sometimes this doesn't happen while you're in the hospital. It could happen while you're at home. Please let your medical doctor know if you have a change in symptoms. Pneumonia is a complication that can arise and something that can be easily treated if caught early. Please, if you have any symptoms of coughing, fatigue, or feeling as if you have the flu, let your medical doctor know. As we talked earlier, when you have a total shoulder replacement or a total knee replacement, you could get a block performed by anesthesia. When they give you a block, they are blocking the nerve, and that could make you have a loss of function until the block wears off. Sometimes patients with a total shoulder replacement will feel a little nervous because they can't wiggle their thumb and their fingers. This is something that is transient and will go away, but you need to make sure you protect your thumb and fingers. If you can't feel them, that means that they could get pinched, and we don't want to damage the skin or the fingers. So make sure you wear your sling, and just make sure that you continuously try to check your fingers and make sure that they're not being impinged. The same with the knee. A block could change the way that your knee functions. Most of our patients with the knee blocks have no residual symptoms, but every once in a while we'll have a patient who feels that they're unsteady when they walk because of the effects of the block, or they feel like their ankle won't bend and up and down motion because of the block. This is transient and will go away. However, when you get up to walk, we need to make sure you're safe. Physical therapy will assess you to make sure that the blocks are not interfering with your ambulation. If the blocks are interfering with your ambulation, we may need to put a brace on your knee or your ankle until the block wears off. Again, these blocks are just a small complication that can arise on just a few patients, and they're easily treated with a brace of either the knee or the ankle. Another thing that patients are surprised after a total joint replacement is that they can get spasms. Sometimes spasms will occur in the calf or in the upper arm or in the thigh. That is something that we can treat with medication, so if you notice spasms arise, please let us know. Also, patients could have a feeling almost like restless leg, like they're trying to sleep at night but they just can't get comfortable. Unfortunately, this feeling could persist for a few weeks after surgery. I know it's difficult to get a good night's sleep after a total joint replacement, but try to remain active during the day. Try not to take naps, and hopefully this will go away quickly for you. Numbness around the incision is not something that may always go away. A lot of times when we cut through the skin, small superficial nerves are damaged, and that numbness may persist. Usually gets better over the course of a year, but it may never completely go away. And that is just a risk that is taken whenever you undergo a total joint replacement. Blisters can occur after the surgery as well. A lot of times what happens is the joint will swell so quickly that that fluid is pushed out into the outer layer and causes a blister. It most of the time happens in a total knee replacement. I really haven't seen many in a hip or a shoulder, but the total knee replacements on occasion do get blisters. If you notice a blister, please keep it covered and do not rupture it yourself. We need to make sure that we keep it covered with a sterile bandage so we do not get an infection. Some of the blisters will be very small and sometimes they can be large. Not everybody gets blisters, but if you do get blisters, let us know. We may need to see you in the office. Sometimes we treat you with a medicated cream or an antibiotic. Bleeding can occur after surgery as well. Most of the time, bleeding again occurs from the total knee replacement. The total shoulder or the total hip may bleed at times as well, but a lot of times it's the total knee replacement that notices bleeding. At that time, you're going to want to make sure you give yourself a clean bandage and change it daily. And remember, if something is coming out of the incision, such as blood or drainage, that's a port for infection to go in, so you need to keep it covered. There are two types of infection that we need to watch for after you have a total joint replacement. Simply cutting through the skin causes a potential site for infection. Even though we sterilize you in the OR, there's always a risk of an infection called cellulitis. And that's where the incision gets very red, irritated, and sometimes has drainage. Sometimes patients will go home and their incision looks great when they're in the hospital, and then a week later or a couple days later, they notice it getting more and more red, painful, and drainage. If that happens, we'll need to see you in the office, as you may need to be on an oral antibiotic. Usually these infections, if treated early, can be treated with an oral antibiotic, and then the patient goes on to heal normally. Other infections can go deep. That's when it's called a septic joint. Sometimes if you get a cellulitis and it's left untreated, that infection can go deep in the joint. If the joint is infected, this cannot be treated with an oral antibiotic. A lot of times it will require surgical intervention. We will have to take you back to the OR and either wash out the joint or remove the joint that we just put in and put in a new total joint replacement. Another way that you could get a septic joint is from a secondary infection. Sometimes, if patients go to the dentist and they do not take their dental prophylaxis, or if they have an infection that they've had for months and they haven't had it treated, that infection could migrate through the bloodstream and attack your total joint replacement. I have seen this happen before, and it is devastating. Once we had a patient who had a bladder infection. He just thought that he was getting older. He didn't think it was a bladder infection. He just thought that difficulty with urination was something that happened with old age. He let his symptoms go for months and months and months. Eventually, that bladder infection went into his bloodstream and attacked his total joint replacement. He ultimately had to go to the operating room. We had to remove the hardware. He then got IV antibiotics for 6 weeks until we were able to put new clean hardware in. We eventually got him infection-free, but it was multiple surgeries, and all of that could have been avoided had he gone to his medical doctor and had his bladder infection treated months prior. Please, if you have any signs of infection anywhere in your body, you need to make sure you go to your medical doctor right away, as if left untreated, it could migrate to your total joint replacement. Blood clots is something we try very hard to prevent. Blood clots are called deep vein thrombosis. They usually occur where the veins go deep in the muscle. Most commonly are in your calf, but they can occur in your thigh or in your upper arm. If you notice muscle pain that's unusual, or swelling or redness, please let us know immediately. This is not something you want to wait until your next appointment. If symptoms occur while it's the weekend or after hours, please go to the emergency room, as an urgent care does not have the equipment to assess for a blood clot. Blood clots can be prevented by taking your blood thinning medication. We will decide what blood thinning medication to give you when you come in for your history and physical. Blood clots can also be avoided by exercise, wearing your compression hose, and doing your ankle pumps. But even with all that in place, you are still at risk for a blood clot simply by having the surgery. Please, if you notice any swelling, redness, or pain in the calf, go to the emergency room or call our office and we can get the scan for you. Periprosthetic fractures are fractures that occur during surgery around your new prosthesis. When we do a total joint replacement, we are removing arthritic bone and replacing it with metal and plastic. Metal is very hard, and if your bones are very soft, because you have a medical condition like osteoporosis, a fracture can occur. This is a total knee replacement model. This is the femur, which is the long bone of your thigh, and this is the tibia, the shin bone. The kneecap or patella is removed from this model. When you're laying down in the OR, the knee is bent and Dr. Perona will cut off all the arthritis and place a metal piece on the femur. He then will saw off all the arthritis of the tibia and tap down the metal portion in the middle of your knee. As this taps down, there's a chance that your bone could fracture. If your bones are weak, this fracture could occur. Sometimes the fracture is very minimal and it changes nothing with your recovery. Other times the fracture could be bigger and Dr. Perona would have you wear a brace. or he would limit your weight bearing and not let you put full weight on it. These fractures are very rare. They don't happen very often, usually less than one a year. So they're a very rare occurrence, but if they do occur, we do need to catch it quickly. We see it on the x-ray. Dr. Perona can see it during the procedure, and we know immediately if you have a fracture that occurred in the OR. Then again, you would be placed in a brace until it heals. This fracture would heal just like any other fracture in approximately 6 weeks. Fractures of the knee, again, are very rare. This is what a partial knee replacement looks like. Again, this is the femur and the tibia. This is the long bone of the thigh, and this is your shin bone. You are only a candidate for a partial joint replacement if your arthritis is localized at one side. He would then remove the arthritis and replace it with metal and plastic. You can see in this model that we tap down this metal piece barely a ½ inch into the bone. I've been with Dr. Perona 15 years, and I've never seen anyone get a fracture from a partial joint replacement. In the 15 years, I may have seen 3 or 4 of the total joint replacement knees getting a fracture. Again, it's a very rare complication. This is what a total hip replacement looks like. When you're in the OR, the first thing they do after they make the incision is they actually pop your hip out of socket, and then they cut off the arthritis. Then this is tapped down into the femur bone, which is the long bone of your thigh. This is a huge prosthetic device. This is not typically what would be inserted. Usually it's only half of this size. However, this would be tapped down into the bone, and the risk of fracture is much greater than the risk of fracturing with a total knee replacement. If you were to fracture after a total hip replacement, Dr. Perona would put a wire around the fracture. Sometimes he will only have you do partial weight bearing until it heals. All of these fractures would heal. A total hip replacement fracture is also pretty rare. We may have 1 or 2 a year, and again, that's very rare considering we do 8 to 10 totals a week. When you decide to have your shoulder replaced, there are 2 types of total shoulder arthroplasties. There is a total shoulder arthroplasty that occurs when your rotator cuff is intact, and one that occurs when your rotator cuff is torn. A total shoulder arthroplasty basically is a ball and cup type of, a ball and socket type of prosthesis. So basically, your cup and your ball and socket, your arm would rotate like this. If you have a total joint replacement and your rotator cuff is intact, we can replace the ball, and then it would go in through your humerus, and that is the normal anatomy. However, if your rotator cuff is torn, we cannot do the same normal anatomy when we replace your joint. We call it then a reverse total shoulder arthroplasty. We would put the ball on this side, the socket on this side, and the arm would rotate like this. So just to reiterate, a ball and socket joint for the total shoulder replacement would work like this. But if your rotator cuff is torn, it's still a total shoulder, but it's a reverse total shoulder. We're putting the ball on this side and the socket on that side. The risk of having a periprosthetic fracture after a total shoulder arthroplasty is low, but it can happen as we tap it down into the humerus. If that were to happen, just like the hip, we would put a wire around it, and we might limit your weight bearing, not letting you push off a weight on that arm. So the last thing we need to talk about is discharge instructions. When you leave the hospital, the nursing staff will go over all your discharge instructions, and they will be written out for you. The pharmacist will go over all your medication. We send everybody home with some sort of pain medication. For some people it may be Tylenol, for other people it may be an anti-inflammatory, and for others it could be multiple medications. These would all be discussed with you prior to discharge. We send everybody home with some sort of medication to thin their blood. We definitely need to protect against any blood clots, and a blood thinning medication is very helpful. We would also give you instructions to follow up with Dr. Perona or myself in the office in 1 week's time. That's your first post-op visit. Then we will see you a month after that and every few months until your year anniversary. After a year, if you're doing great, Dr. Perona will completely release you and you will follow up with us on an as-needed basis. We ask that nobody drive once they leave the hospital until they get the okay from our office. The criteria for driving is you need to be off of all pain medication, you need to be able to get in and out of the vehicle by yourself, and you need to be off of the assisted device such as the walker. We will definitely discuss this with you as we see you for post-op appointments. It varies greatly when patients are able to return to driving, and it depends really on how active you are and how quickly you meet through your goals. Some patients are able to return to drive after 2 or 3 weeks. Other patients, it may be 10 or 12 weeks. It really just depends how quickly you recover from the total joint replacement. We do ask that everybody wear their compression hose after the surgery. Again, we're going to do this for 6 weeks total, and they will be on your discharge instructions. Put them on first thing in the morning and take them off at bedtime. Your bandage and incision instructions will be given to you when you leave. Again, some patients will have a wound vac, some will have the 7-day bandage, and others will be bandaging themselves every day until the bleeding or blisters resolve. Polar Care will go home with the total shoulders and the total knees, and instructions will be given. If you have any questions about that, give us a call. Physical therapy will be initiated for the total hip replacements and the total knee replacements. They typically start physical therapy right after they leave the hospital, but the shoulder replacements usually get educated on a home exercise program and do not start formal physical therapy until a week after their surgery. The total hip and the total knee replacements typically go to physical therapy 3 times a week, either through home health or outpatient services. Again, that we ask that everybody use a stool softener, and you can pick this up at your local pharmacy. The hip and shoulder, because they are a ball and socket joint, will have shoulder and hip restrictions after surgery. These restrictions will be in place for 3 months time, and our physical therapist will go over those restrictions with you. Again, dental prophylaxis is recommended for all of our total joint replacements. Anytime you go to the dentist, you need to take an antibiotic 1 hour prior to prevent infection. If your dentist does not supply that medication, please call our office and we would be happy to do that for you. Lastly, if you have any questions at all, please don't hesitate to give us a call. Bridget is the joint coordinator, and she'd be happy to answer any questions, as would anyone else in our staff. Thank you for choosing St. Margaret's for your total joint replacement. I look forward to working with you all.
Following Carrie, I'd like to speak with you today about your anesthesia care during your surgery. We will be talking about 3 different types of procedures today. You're either going to have a total knee replacement done, a hip, or a shoulder if you're watching this video. With the total knee replacements, I'll start with those. We will come up to see you the day of surgery, ask your anesthesia history, and most people that are getting the total knee replacement end up getting a spinal anesthesia. With the spinal anesthesia, we will bring you down to the operating room, clean off your back with a cold sterile solution, numb it up. We'll give you some sleeping medicine through your IV so you'll be nice and relaxed, and then we do a one-time shot to numb you up from the waist down. Once you're nice and numb, we lay you back down and you get to take a nap through the rest of the case. So some people remember hearing a noise or being aware of something towards the end, but most people don't remember a thing from the surgery itself. It's not a complete general anesthesia, so there is a chance that you may remember bits and pieces. Once you get finished with surgery, we will take you over to a recovery room, and in recovery room we'll do a couple nerve blocks for you. Now these blocks there's two of them. One is for the top part of your knee and one is for the back part of your knee. So while you're still numb from the spinal anesthesia, we'll go in and look with an ultrasound and put a large amount of local anesthetic around the nerve that innervate the top part of your knee and the bottom part of your knee. So after that, you should be nice and numb for 12 hours to 24 hours. Some people it's longer, some people it wears off quicker. And that would be the first type that I wanted to talk about. The second type would be the hip surgery. If you're having a total hip replacement done, we will be doing the same sort of anesthesia to start. It'll be a spinal anesthesia. So just like with the knees, you're gonna go back and we're gonna give you a little sleepy medicine, sit you up, do a one-time shot, and numb you up from the waist down. Then we'll lay you back down, get you positioned on your side, and make you nice and sleepy. Only difference is we don't have to do a nerve block if you're having a total hip done. So you can just expect to go to recovery room and wake up and go back to your room, okay? The last type of anesthesia and surgery that I'd like to talk about today is a shoulder surgery. If you're coming in for a total shoulder surgery, it'll be a little bit different for you. It will be under a block and a general anesthesia. So we'll meet you up in the same day. We'll talk to you about both of these procedures. And with the general anesthesia, you will be going completely to sleep. But before that, we take you down to recovery room where we will do a nerve block for you under a little sedation in that room. So we take our ultrasound machine, find the right group of nerves that innervate your shoulder, and put a bunch of local anesthetic there to numb up the shoulder. That lasts about 12 to 18 hours. After that's done, we do take you back to surgery and continue by doing general anesthesia, where you will go completely to sleep and won't remember a thing. Get to recovery room, you should be nice and comfortable because your shoulder should be numb, so you shouldn't need much for pain after that. Risks with any nerve block or spinal, there's a small risk of infection. With the spinal, there's a small risk of a headache or a bruise or a backache. And sometimes with the nerve block that we do for shoulders, it can numb your face or part of your diaphragm. So those are some of the risks and associated with those type of blocks. But the benefits far outweigh that, with the numbness for 12 to 18 hours and the block on your knee that lasts that long or longer.
Hi, my name is Donna. I'm a discharge planner here at St. Margaret's. There are 4 discharge planners in our group, and one of us will be talking to you. Prior to your surgery, we are trying to call everyone at home and find out what help they need at home, if you need a walker, if you need oxygen, or if you have oxygen, or you have a nebulizer, whatever kind of equipment that you use at home, we need to know. Also, we need to know what kind of services are available that you use in your home, if you use any at all. We need to know transportation. How are you going to get to the home from the hospital? We need to know therapy, where you're going to go for therapy if you choose to go to outside therapy. And to contact us before you're in the hospital, you can call 815-664-1486, and you'll get Leanne, who's our secretary, and she will direct you to the right person. Okay, so there's different discharge options when you leave the hospital. One of the discharge options is you can go home with your family, with your spouse, and you can choose to go to a rehab facility. And we have a list of rehab facilities that we can send to you if you need. We usually use St. Margaret's Rehab, which is in Peru. You usually go 3 times a week for 6 to 12 weeks. It all depends on your progress. If you need transportation, that can be arranged by the rehab facility. The second thing you can do is go home with your spouse or significant other or family, and you can have home health. One of the biggest rules with home health is that you have to be homebound, which means you cannot go to the store, you can't go visit people. The only places you can go is to church or your physician, if because of COVID that's even available right now. If you choose home health, we also have a list of home health agencies in the area. Dr. Perona works with Prairie Land here, but you can choose any home health agency you want. What will happen is while you're in the hospital, we will send a referral to the home health agency. They will call you probably when you return home and set up an appointment for your initial visit. Home health never comes without someone having an appointment. They just don't drop in on you. Not all the home health agencies accept all the insurances, so that has to be checked out. We'd like it to be checked out before you are in the hospital, but usually the home health agency will do it when we do the referral. Currently, we are encouraging people who want to go to a nursing home rehab program, which means you're in the nursing home for the rehab program, to hold off your surgery. Right now, because of COVID, it is very, very difficult to get into a rehab facility. And if you do get in, you have to know that there's a quarantine for 10 to 14 days, which means you cannot have visitors, you cannot see any of your family. You can have phone calls, you can do video stuff, but nothing in person. If you choose that after the COVID issue is over, you can call the rehab facilities or you can go and visit. And we encourage you to do that so that you know what you're getting into. Right now, you need to ask, if you call, you need to call and you need to talk to a marketing person, not the person that first answers the phone, because they usually don't know all the answers to your questions. You need to ask about retention of staff, how long the staff have been there, how many nurses per patient, how many aides per patient, what the usual time is to answer a call light. And also, if you're going to visit, and this is after the COVID issue, if you visit, go at the busiest times, lunchtime, supper time, bedtimes, so that you really see what it's like in that facility. Another way you can find out how good the facilities are is you can go to www.medicare.org. It's on the internet. Click Nursing Home Compare, and it's usually at the top left-hand corner of the paper, and type in your zip code. This will give you the updated government reviews and ratings on each nursing home. And it's always not the prettiest and nicest decorated nursing home that's the best. Sometimes you'll be surprised that it's the one that you don't think is the best that is not pretty. And other things you need to do to prepare yourself for after surgery is make sure that in your home there's nothing to trip over, that there's no loose wires, cords, throw rugs, uneven flooring between doorways. You also should have a phone that's portable so that you don't have to get up all the time and answer the phone. If you need a temporary disabled parking card, call Dr. Perona's office and they can assist you. They cannot get you long-term ones, but they can get you temporary ones. In your bathroom, make sure you have grab bars, shower chairs, non-slip suction mats, non-slip rugs in your bathroom. Also, you may need a raised toilet seat or a higher toilet. It's just easier to get up. Before surgery, prepare food. Have it in the freezer so you don't have to get up and cook all the time. If you need medical equipment, we can get walkers. That's about all we can get that's economical. Otherwise, if you need some of this other stuff like the raised toilet seat and that, go to Walmart, Walgreens, CVS, one of those drugstores, because the price is going to be much cheaper. The other thing is there's lending stores, one in Bureau County, and it's the Bureau County Senior Center in Princeton. The number is 815-879-3981, and Putnam County Senior Center in Standard, and it's 815-339-2711, and you can borrow walkers and all kinds of equipment there. One of the things we need you to know that you need to have somebody stay with you at least 72 hours after your discharge. This is because you're on medication, you've got a polar ice and everything, and just to help you walk and just daily care, it's good to have somebody at least there for 72 hours. The other thing we need people to know is in the past, Medicare has paid for nursing homes, but now you're not going to be staying 3 nights. And right now, there's a waiver for a nursing home if you go. And the 3-night is not an option. There's no rule that you have to be here 3 nights, but that's going to end because insurances now are saying you can be here the night of surgery and then you're discharged the next day. And this is all insurances are saying that, not just Medicare. Transportation home, we encourage you to have your family transport you. It's very difficult right now to get paratransit because they're very busy. Ambulance transfers home. Medicare is saying that if you can sit in a chair, you do not need an ambulance, and you'll end up paying that yourself, and that could be as much as $800 to $1,000 to go home. So we encourage you to find transportation. If you're having shoulder surgery, home exercises will be given to you by physical therapy and will be done the first week at home. We do not schedule any kind of therapy. You'll see Dr. Perona's office and then they'll schedule therapy. One of the things you need to do is to practice before you come in. If it's going to be your right arm that you're not going to be able to use, you need to practice with your left arm to be able to dress, to be able to do anything. So practice, practice, practice. Hips and knees, you'll need a walker. Bring your walker with you to the hospital because it needs to be fitted for your weight and height. You can also get through the Medicare or insurances or pay yourself. It's usually about $30 to $40. The toilet risers, the sock pullers, the grabbers and everything. You can get them through us, the grabbers and the sock pullers. It's like $36 basically for them. Or else you can go to Walmart, CVS, Hy-Vee, any place and get them. If you have commercial, any kind of insurance that you have, you need to find out and to be sure that you can verify that the hospitals in network, the medical equipment companies in network, outpatient is in network, and the outpatient PT and your surgeon. Call your insurance. This is your responsibility to know what your insurance pays and what they are willing to pay. Now, because of COVID, there's a lot of insurance issues changing, and it might change every day. We really do not know for sure every day what the insurance is paying, so that's why it's very important that you call and that you talk to your insurance coverage. As I said, if you have more questions, please call us at 815-664-1486. Thank you.
My name is Gary Kistenfeger. I'm the physical rehab manager at St. Margaret's Health. I'm going to be talking a little bit about the physical therapy, occupational therapy, rehabilitation with the total joints. First thing I'd like to just mention everybody is that we do have a pre-hab physical therapy session that we like to have people go over to Peru, Illinois, to go over by Midtown Clinic, which is right next to Culver's Restaurant. It's in the little strip mall, which is right next to Sherman-Williams. And that prehab consists of going over to the outpatient rehab center, St. Margaret's Outpatient Rehab Center, and getting exercises that we'd like you to do before surgery, talk a little bit about walking, how to do the stairs safely. So it's just a nice way to get yourself ready for your total joint replacement surgery. The exercises I'm going to go over with you as well will be available online, and those are the same exercises you'll be doing before surgery and the same exercises you'll be doing in the hospital after surgery. The most important thing about the exercises that you want to make sure you go slow, you go controlled, and you avoid pain. This is critical before the surgery. We don't want to flare up the joint that's already have arthritis in it, and we don't want you to exercise causing pain. The old adage, no pain, no gain, is not true as far as before surgery, and certainly the day of and after surgery, you don't want to be exercising too hard, too fast, and too painful to get the best outcome. Let's talk about the day of surgery now. The day of surgery, we'd like you to bring your own walker. We'd also like to bring your cane if you have that for stairs if you're going to be going home after surgery. That way we can fit your walker and fit your cane for the proper height for the patient. A lot of times people have them, but they've been used by somebody else, so we like to make sure they're fitted properly, and then also make sure they're operating properly and there's no components that are unsafe. So please bring your walker and your cane the day of surgery, and we'll take it from you, and then we'll be using that with you when we're getting you up after surgery. Speaking of that, we will also be exercising you and doing gait ambulation the day of surgery, so be prepared to be getting up the day of surgery. We will wait for the anesthesia to clear, and then we'll be getting exercises going and also ambulating you with the walker, with the gait belt, and with 2 people. Physical therapy will see you then the day of surgery, as we just talked about. We'll be getting you up. Once we get you up with physical therapy, then you can get up with nursing staff after that. But just recognize that physical therapy has to get up the very first time just to basically certify that you are safe to get up with the walker, with the gait belt, and with 2 assists. So speaking of that, also realize that you will have a nurse's call, and you must use that to get up out of the chair and or out of the bed. You cannot get up on your own just for safety reasons. And again, you always have to use your walker, the gait belt, and 2 hospital staff personnel for your safety. And just make sure you're recognizing that so you're not wanting or try to get up by yourself or just with 1 person. Physical therapy will be seeing you twice a day. We'll be exercising you in the morning and afternoon exercise. Also, physical therapy will be seeing you in the morning for ambulation. Physical therapy will also be seeing you in the afternoon for ambulation and gait training and getting you ready to be discharged to home. Let's talk about the proper adjustment for your walker and your cane. If you want to do that before surgery, that's fine. So you've got the proper posture. The walker handle should hit right at the wrist bone. So the proper adjustment for your walker handle is if you're standing up tall, that this is going to hit right at the wrist bone. We don't want it too low, so you have to bend over. We also don't want it too high, so that you're like this. Again, the adjustment of the handle, if you're standing up straight and tall, should hit right at the wrist bone. Same thing for your cane. It should also hit at the wrist bone. Now let's talk a little bit about the proper gait ambulation cycle. So what I want everybody to practice is doing a good gait with the walker. What that means is you're going to take the walker out in front. Your left leg's a surgical leg. If your left leg's a surgical leg, you step with the surgical leg first to the middle of the walker, and then you step with the right leg equal. Again, to repeat, walker, surgical leg, right leg. Walker, surgical leg, right leg. Notice I am bending my knee properly. I'm not keeping it stiff. We want a nice little knee bend. Every time you take a little step, it's a little knee bend. And notice I'm not going far. You do not want to be out here or trying to go this far with your step. Again, just a little half step. So if you think about just a little half step with a good knee bend, and then just equal, using your hands. You always want to use the walker for safety. The cane is only for doing stairs. And we will talk about stairs here in a little bit. Also, occupational therapy will be seeing you. Occupational therapy is going to be showing you different kind of aids to work on getting bathed. Also a reacher. If you are a hip, the reacher is for you're not bending over. So the reacher will be shown to you by occupational therapy. A little shoe lift for the hips and the knees to be able to get your shoes on and off. And also a little sock aid for occupational therapy to show you how to get your socks on safely without bending over at the hip. The most important thing about physical therapy is that you don't overdo your exercises. Gentle, slow, and steady wins the race. The old story of the tortoise and the hare, we want you to be the tortoise. We want you to go slow. We want you to go easy. We don't want you to push, push, push and try to finish first. Those people often have a setback and they get discouraged because they did too much, too soon, too fast. The things to avoid with the total knee replacement is you do not want to bend your knee excessively into what we call flexion. So flexion is where you would bend the knee backwards, and so that bending mechanism would be like this. You don't want to bend your knee too far back because that will open the incision of your knee and could cause it to bleed. So again, straightening is good for the total knee, but bending it too far back when you're sitting in the chair is something that you want to avoid, and don't push that. A precaution with the total hip is that you do not want to go ahead and cross your legs. So no crossing your legs is the total hip. Also, when you are sitting, you don't want to bend over and pick up anything off of the floor if you drop something. The important thing about that is if it's a pen or a piece of paper, it's not the weight of the object. It's when you bend over, the ball in the socket could pop out if you bend too far. So you want to use your reacher aid to pick something up off of the floor, including something light like a paper. So again, just to avoid the flexion of the hip with the total hip replacement. If you are going home, we will want to do stairs with you. So if you have stairs, the important part about stairs is if you can have a railing or install a railing before surgery, it makes it much safer to have that before you have your surgery. Also, we will be using your cane with the stairs. You can't put a walker on multiple steps. So that is why a railing is very important, because you're going to have the railing on the right side, your cane on the left side, and we also recommend 2 people to be with you when you go home the day of discharge just for safety. It's really not safe to be doing stairs with yourself and just one other person. So a neighbor, a son, a daughter, a family member, a friend, besides the one who's going to pick you up at the hospital. So the recommendation would be have 2 people to get into your house that day of surgery. After that, most people are fine with just one, but you've gone through a lot in that 24 to 48 hour period, and we really want to recommend 2 people for safety. Speaking of going home, we also want to quickly let you know about the vehicle. It should be a vehicle that is of a standard nature, that's more of a standard height. Something that's really high, like a jacked up truck, or a truck that has running boards, is not easy to get into for the total joint patient. Also, something very, very low is very hard to get out of for the total joint patient. Small vehicles are hard to get the leg, the knee, the hip into the front seat, so you should avoid also real small cars. So just a little heads up on the kind of vehicle you're going to use. Again, if you've got to borrow a son or a daughter's to make it better for the patient to get home, just wanted to mention that to make it easier for people to get the patient into the vehicle safely and easily, and then also getting them out safely and easy for easy transport from the hospital to your home. The last thing I want to talk about is just outpatient therapy is going to continue the therapy process. Outpatient therapy will usually be 3 days a week, usually Monday, Wednesday, and Friday. Our outpatient rehab center phone number is 815-223-8600. Again, 815-223-8600, and that's our outpatient physical therapy center over at St. Margaret's in Peru, right next to Culver's. So for the prehab and for post-therapy, just do that number and we'll take really good care of you. The last thing is the total recovery for the total hip or total knee, the total joint replacement is 6 to 12 months. So if you are geared towards understanding that it is a process, it's a 6 to 12 months recovery time, and you got to give yourself that time to get better. And the most important part of that is that you continue your exercise program for those 6 to 12 months to get the maximal benefit from your total hip replacement surgery. Good luck, and we look forward to seeing you at St. Margaret's Health. Thank you, everybody, for checking into our St. Margaret's Health Total Joint Replacement website and Total Joint Replacement program. We appreciate you being a patient of St. Margaret's Hospital. Thank you for choosing Dr. Perona for your total joint replacement surgery. And if you have any questions regarding anything with the total joint replacement, Dr. Perona's office would be the best place for you to start with a phone call to get proper guidance to any questions that you may have. Thank you.
Hello. As you know, I am Dr. Paul Perona, and I just want to thank you for choosing us to have your hips and knees done. We're very honored, and I can guarantee you that we will do the best job that we can. I think you'll be very satisfied with not only myself, but with all the other people that you'll be working with, including the nurses, the therapists, anesthesiologists. I'm very confident that you'll feel that this is a very fulfilling and beneficial procedure. I want to thank you for tuning into our preoperative joint class. I feel the class is very rewarding and can be very beneficial in preparation for a joint replacement.